The average child in America is exposed to 5 pesticides daily in their food and drinking water. Switching to an organic diet for just 5 days virtually eliminates any sign of exposure to organophosphate insecticides among school-aged children.
It's no secret that childhood obesity has become a major health problem. Rapidly increasing in kids and causing a number of health effects already. Type 2 diabetes, what we used to call adult onset diabetes, is already more common than type 1 diabetes at age 9 in elementary school.
Fruits and vegetables are grown on less than 8 million acres in the U.S. If this acreage was converted to organic production, coupled with a shift to all organic imported fruits and vegetables, pesticide dietary risks would drop by an estimated 97%.
In looking at the causes of obesity, obviously kids are eating more calories and exercising less than they did in previous generations, but there's a growing consensus that eating more and exercising less isn't enough to account for the rapid rise of obesity. So we've begun looking at environmental causes. In animal studies, where everything else is controlled, the animals have the same amount of food available, the same type of food available, the same exercise opportunities, just by adding certain kinds of estrogenic chemicals to exposure to them, especially in their diet, you can get obesity in one group and not the other group. But of course, you can't do this study exactly in kids. But there was one study that just came out in the September 2008 Acta Pediatrica, where they looked to see if what you might expect in kids who had been exposed, if they were exposed to pesticides in the womb. The way they did the study was they measured umbilical cord blood, looked at pesticide levels at the moment of birth, and then followed these kids for 6.5 years to see in elementary school if there was a difference in their body weight controlling for everything else. And they found exactly that. The kids with the higher pesticide levels, pesticide exposure from food, not from agriculture, living near agricultural fields, but those with the higher pesticide levels were 2.5 times more likely to be overweight and 3 times more likely to be truly obese. This is the first study of its kind in people, but it suggests that pesticides may be having an impact on obesity in kids, maybe even in adults.
A nationwide study found elevated risk for several types of childhood cancer for children living near fields treated with pesticides.
I was very, very healthy. I ate all my vegetables. I definitely had chocolate from time to time, but more so, I was athletic. I was thinking positively. I definitely had stress in my life like everybody else. And then I got diagnosed with Hodgkin's lymphatic cancer out of the blue. And I started looking at what exactly was I eating. And I started looking at labels and I started realizing, oh my gosh, I'm not eating everything organically. I'm not, there's this particular ingredient that's a cancer-causing agent in my shampoo. What's going on with my lotions? Everything I started to take a hyper-focused look at. And I started to realize that if I don't pay the cost for organics, I'm going to be paying the cost in a hospital.
Impacts of prenatal and early life exposure to pesticides are among the most significant factors for cancer, reproductive systems abnormalities, birth defects, and neurological problems. Nursing mothers consuming mostly organic milk and meat produce breast milk that contains up to 36% higher levels of heart-healthy CLAs. The improvement in breast milk nutritional quality is brought about by greater reliance on pasture and forage grasses on organic dairy farms.